Hi, so today is March 4th, 2022, and I was at the Macungie Ambulance Corp, and this was my first and only day at the experience. I worked with Phil, Dan, and Corey, and we had 4 calls today. The first call with me, within the first 10 minutes of me being there, was a motor vehicle crash, and it was a pediatric motor vehicle crash. So basically there were 4 pediatric patients in a car heading towards high school, and they were making a left turn, and they collided with an oncoming car, and their car flipped onto the side. So the main patient was a 14-year-old male with a head injury. I don't think no one else was really affected. It was just him as the patient. So we got to the scene and he had already been extricated from the car. We're not really sure who. I think maybe a pedestrian helped. And so we were trying to figure out the situation. One paramedic went and was talking with the mother and two of the other kids who were in the vehicle, and then the other paramedic and I were dealing with the patient and his sister. So his sister was in the car with him, but she didn't have any physical issues, and she was just kind of making sure her brother was okay. But we put an ABD pad on him. We were asking him some questions, name, date of birth, did a little neuro workup, and then we got him into the gurney, got him into the ambulance, and so that was our first one. He ended up being okay. There was no severe head trauma. It was mainly just he had a big laceration. He had a lot of lacerations in his hand. He had a big one here with lots of glass in it, so we had to go in for a washout once he got to the children's ER. Our second call was another pediatric case. The child was 5 with a fever. And then our third call was a woman who had chest pain and a 20 out of 10 headache. And then our last call was an elderly woman in a dementia care unit, and she was complaining of numbness and tingling in her hands. So for the first call, I tried to participate, but it was my first call and I was a little I don't know what to do. The second call, I was able to participate with taking the little boy's vitals. I was able to get a manual blood pressure on him, and then also trying to calm him and then his little 2-year-old sister down because she was crying. And then for the third patient, I was able to perform an EKG on her, and then also I listened to her lung sounds as well, her lung and heart sounds. And then for the fourth patient, with her, it was a lot to do with anxiety, and she was kind of hyperventilating, so kind of getting her breathing under control. Also trying to talk to her and distract her while the paramedic was starting a line. So there was a lot kind of going on, but I did try to participate as much as I could, where I could. But yeah, it was a great experience. And then for the course objectives, it's hard because we do end up meeting all of these within the day. Course objective 9, recognizing responsibility for one's personal and professional role in promoting the health and population in the region, in the nation, and worldwide. So accountability and professionalism, so being well dressed. I also emailed them a couple days prior to my arrival. Also just kind of letting them know where I am in the nursing program, what I can do, what I can help them with kind of thing, and jumping in when I could. Also, course objective 8, analyze the community health nurses' role in emerging patterns of regional, national, and global healthcare. So being adaptable, this type of like pre-hospital, you have to be super adaptable and flexible because you're walking into situations that you have no clue. You could be walking into a house, you could be walking into like a retirement home, you could be walking onto the site of a motor vehicle crash, and you just kind of have to be prepared and ready for whatever's thrown at you. And then also, let's see, another objective was 4, collaborating with other members of the healthcare team. So the EMS personnel, like the paramedics, they collaborate a lot with the nurses, the emergency department nurses. So that was really cool to see as well, and talk to them about the patients. Overall recommendations, if I could do anything differently, honestly, no, because I mean, I wish I could have jumped in a little more, I guess, on the first one. I did help where I could, like I helped hold the ABD pad on the client's head, but that's also, it was my first experience, so I was kind of like, and in the other ones I feel like I made up for that. So yeah, I would recommend Makunji again. They were a great staff, they were welcoming, and it was a good day. Thank you.